Hey guys, Dr. Sampson Davis here. So I'm standing in the weirdest place right now. I'm standing in my attic. And the reason why I'm shooting from here is because of what I found here. My attic is nothing fancy, it's just a crawl space, more for storage. I live in a woody area, so I had pest control come out not too long ago to set up some traps. And one of the traps here I want to show you is clean now. But this trap right here, as you can see, is put in place to capture these little critters as they may appear. Now, I didn't expect to capture what I caught. I found a bat here in my attic not too long ago, and I had to take careful diligence and steps in removing the bat. Now, keep in mind, it made me think of this segment on rabies. When you think of rabies, you think of somebody being out of their mind. They're being crazy and off balance and insane. And part of that is because rabies act on the central nervous system or the brain. So in its final stages, it could cause an animal or a person to sort of go out of their mind. And now, so there are certain animals. What animals carry rabies? And it's mostly warm animals or warm-blooded mammals or animals that you think of that carry rabies. Most commonly are your dogs and your cats, but also skunks, coyotes, raccoons, foxes, and cattle can carry rabies. The good news is animals such as squirrels or pigs or rats, they don't carry rabies at all. With the treatment of rabies, the CDC reported, which is good news, that rabies is on a decline as far as deaths, especially in human. There was only one reported case of rabies in 2014. If you look back years ago, centuries ago, there were like hundreds of cases a year of people affected with rabies. And with animals, we still see a real large increase, thousands and thousands. CDC report over 6,000 cases in 2014. So here's what has helped to improve the decline in rabies. One is vaccinations. More people are vaccinating their dogs and their cats, which is really, really important. Also, with humans, there's treatment. There's a rabies vaccine, and there's a that you go through if you come in contact with an animal. Now, how do you contract rabies is always the question. It's transmitted through the saliva, so not through the blood or not through the urine or the feces, the saliva. So in the final stages, an animal who's out of their mind will secrete the rabies toxin through their saliva. So if you're bitten or come in contact with secretions or saliva of the infected animal, you can contract rabies if it penetrates through your skin. So most importantly, you want to make sure you vaccinate your dogs. If you come in your pets, rather your cats and your dogs, if you come in contact with an animal that's acting bizarre and out of their mind, you want to call animal control. And you want to make sure you go get treatment, because once rabies sort of invade your brain, it's too late. And you may not have symptoms. Some of the symptoms may be muscle fatigue, body aches, fever, nausea, dizziness, more common like flu-like symptoms. But in its final stages, once it penetrates through the brain, it's too late. It's too late. So you want to make sure you go to see an ER physician such as myself. You will be given a shot, and you have to come back for 3 more doses of medications if in contact with a potential rabid animal. So you would have a shot on day 1, then day 3, day 7, and day 14 or 21, a series of 4 shots. So you see this picture here of this cute bat, right, eating some fruit. I know it looks a little cute and pet-like, and you want to sort of touch it, but you never know for certain which animal may have rabies. So do not come in contact. Call pest control and admire the picture from afar, but make sure you do not sneak up on that bat. And if that bat was to bite you, you won't not become Batman, but you may develop rabies, and that obviously in this point could be life-threatening. And so make sure you notify pest control and stay far away from the animals that are acting crazy and wild.